Good afternoon, everybody. This is Attorney Danyl Patterson, candidate for the 190th State Rep seat. For those who don't know, that's West Philly, baby. I'm going to tell you how the Lord provided. So today was Let's Talk About It Tuesday. I advertised that. I said, hey, I want to know what's up with you and what do you want to talk about? What do you think? What's going on in your world today? And somebody immediately said to me, you know what I want to talk about? I want to talk about 5G towers and the conspiracies behind COVID-19. And you know what? Here she comes. So today, with no further ado, I'm going to introduce you to A.V. Hankins, M.D., and a whole bunch of other letters y'all are going to see. She is of Hankins and Associates Medical Practice, Medical and Community Practice, LLC. I want to welcome her. Thank you.
Hello, thank you for inviting me.
Good afternoon, Dr. Hankins. So this was very exciting. I was just telling the audience that definitely when you ask, you get answers. And so I always like to bring the experts on. So many people have so many questions about COVID-19, the Black community, testing, the conspiracies around it, the myths around it. They don't understand the facts around it. You know, Black people can't get it. It's really the 5G towers. We're not unhealthy. That's not the reason that we're getting it more. They're just reporting more on the Black community. I hear it all. And I know that you really do too, because you're actually doing the screenings. First, can you tell us about that, doctor?
Well, actually, what I'm doing is the pre-screening. I was contacted because of my community work, because what we're trying to do is change that 50 to 70% mortality rate that happens with COVID patients that are Black or brown that go into the hospital. So the idea is to expand the screening base and to get people treated earlier if, in fact, they do have the disease.
I just wanted to take that time, make sure I give everybody your number. The office number for Dr. Hankins is 215-842-1075. That's 215-842-1075.
Okay, and what I'm going to say is please don't call unless you are interested in a televisit, because we do not have time and this is serious. And you can contact Attorney Patterson if you have social questions, and I'll talk.
Oh, absolutely. Yes, you know, you can always call, me at 267-291-4702 with any with just anything. But I always like to put them in touch with the experts. I'm sure there are a lot of us, and you know there are out in our community that don't have regular family practitioners and internists and have no idea how to get medical treatment. So I always like to bring those resources. So yes, please, we're in the middle of a pandemic. So when you're calling the doctor's office, it needs to be about, you know, your health care. So thank you for clarifying that, doctor. So first, tell us a little bit about yourself, because I know there are people in my community that don't know what an internist is or does. So can you please tell us what that is?
Well, an internist are doctors that go get special training beyond basic training in adult medicine. And I've gone further than that. The letters behind my name, Fellow of the American College of Physicians, that happens when the other fellow doctors vote on you that you're one of the top. And that is very, very rare for Black people, particularly Black females. And I actually received the honor after presenting original research in China. And I'll tell you about that one day. The other one is a master's. I have my master's in education and in public administration. Now, you might say, well, this doesn't have anything to do with medicine, but quite the contrary. The health of a 41-year-old high school dropout is comparable to a 61-year-old college grad. So if we can keep our kids in school, you're adding 20 years of life to them. I call it a social vaccine.
Wow. So you told me that that you're doing the telescreenings for COVID-19. What exactly does somebody need to get a COVID screening?
That I don't know, but with our program is you're coming to me, I'm doing an assessment, a physical an assessment. Well, I'm not going to say brief because some of the people really take some time, but I'm doing a assessment on the computer, because that's the only way we can see people right now, and see if they could go get a COVID-19 test. I am actually, yes, I'm still in Germantown and Price. That's the question that came up, absolutely. But the idea for us is we're broadening our range. I don't want people to just come in because they're sick. Quite the contrary, we're trying to screen, because unless we do that, the statistics are always going to be skewed.
So they're already ready for the meat and potatoes. So one of the things that you and I talked about, and obviously wanted to get right to that, is the myths around the COVID-19, especially as far as the health disparities and how it's impacting the Black community. So can you just explain what you were talking to me about when you said, hey, I want to talk about the virus and how it's impacting us?
Well, there's a whole lot of components to that, but one I need to address is the social media crap. I do not understand how people can peddle death and everybody get on board with it. Now let's say this is the worst case scenario, that it is a conspiracy. There's somebody saying, I'm making this up, nobody's really dying of COVID. What does it hurt for you to be checked out and improve your health? But think about the reverse. Okay, what if in fact this is a disease that is killing almost 4% of the population of the world and has a higher percentage of death for Black and brown people? What if in fact that is true and you're treating it like it doesn't exist? You're shooting crap outside my office, you're playing basketball, you're not having your mask on, and when you have coughing and sputum, you say, oh, I'm a little sick. And then I have to get on the phone and send you Mary behind to the emergency room to screen for COVID. How about this? How about we say that this is real and you love yourself and we want you to live, and let's treat it like that. And when somebody in social media says, I want you to put your life at risk because I have no sense whatsoever and I know everybody's going to follow me, you say, why don't you get a life? Why don't you get a love? And why don't you spread goodness instead of negativity? Why don't you sell health instead of poison? I would just Target. I got to get this in because this really is getting.
I'm listening.
Target because I got to get a new phone because of our telemedicine, right? So I'm there and the employees don't have on masks. So I tell the little smarty in the teller department, I say, excuse me, I have a couple of patients with COVID and you really should have on a mask because you don't know me from Adam's house cat. So he says, well, I don't need one. I said, excuse me, you are here at John Q. Public Target. Okay, why don't you have a mask? So, of course, being the conscientious person I am, I called the manager. And the manager says he doesn't have a mask because we ran out. Now, the majority of workers at Target are Black. It is unfathomable with the money that Target is making, being one of the only places open, that they can't get masks for their employees. I can't speak up for the employees. I'm not an employee at Target. But if that was my son, if that was my nephew, if that was my child, I would speak up. And that's what I'm doing right now. I'm speaking up for him. And I'm saying, Target, you should be ashamed of yourself. And that young man should be ashamed of himself because he should have enough self-worth to say, I'm not going to put my life on the line for this department store that can't even get me a mask.
So, you know what? Immediately what we get is dispelling of the facts. So let's just actually talk about some of these facts that are out there. So Bilal Sabir wants to know, can we speak of how many people are cured or who have come in contact with COVID and are alive and well? And personally, I don't think it's the issue of who gets it and who's cured and who's alive and well. I think that if there's one death, that's really one death too many, because I don't know if I'm going to be the one that gets it and is cured or if I'm going to be the one that dies. We don't know which one we're going to be in, but that's what he wants to talk about. He wants to talk about the fact that not everybody dies. Okay.
Well, of course not. This is why what we're saying is that only 20% of the people that get exposed to the virus get really sick. The other 80% are just I guess, whatever symptoms they have, it doesn't merit really illness. But the point of my discussion and being here today is of that 20%, when the minorities go into a hospital because of it, and again, there are a lot of factors, but when they go in because of COVID, that wrecks their immune system, they have a 50 to 70% higher mortality than a white patient that comes in with just COVID or whatever their problems is.
And why is that? Why is that? Let's talk about the health disparity. Why is that the numbers are more likely, that you are more likely to actually die once you get to the hospital from COVID than you are if you are not a person of color?
Well, I would be lying if I said I knew.
Okay.
But what I can say, if I have some suppositions, okay? The first
Let's
one
talk about some educated guesses.
Huh?
Let's talk about some educated guesses.
Okay. The first one is the fact that we're screening too tight. So by the time a Black or minority person gets into the hospital, they're sicker. It's just like the patients that I sent. They were complaining, oh, when they get COVID, I took the test. What else you want me to do? I said, I want you to do a history and physical. Okay. Now, the man I sent there has cardiomyopathy, pleural effusion, a pacemaker, and heart failure. How about a history and physical? Okay. That's why I sent him. I sent him because I don't want to send him in respiratory failure, because then I'm going to lose him. I'm sending him now so he does not get into respiratory failure. That's number one. Number two, because people will not take the test because they don't want to know. And they're running around playing craps and basketball. Then they're spreading it. So they might be a little sick, but they give it to somebody else who you don't know who's immune suppressed. You don't know who has AIDS. You don't know who has diabetes. You don't know who has lupus. And then when they get that combination, they can't fight it. And then the third thing, which is where I come in as an internist, is there are chronic diseases that can be controlled that are not controlled in the Black community. It's a lot of reasons for that, but my personal, anybody knows me, has dealt with me, knows how I practice medicine, is I treat white people like Black people, and Black people, backwards. I treat Black people like white people and white people like human beings. And when you do that and you don't worry about money, you give very good health care, even though you can't pay your PICO bill.
Well, Jacqueline Brunson says that it seems as if minorities enter at death's door, sent home more often and told to isolate.
I absolutely agree with that. And I think it's a twofold problem with that. Number one is we wait until death's door to go. Number two, we listen to that. See, my thing is I don't understand people being passive. Now, part of it is you're so sick you can't fight, but the other part is we must stand up for ourselves. And that's where a primary doctor comes in. Because when I send my patients, they have to answer to me. And it's a whole different discussion than if they just going in by themselves. So my thing is, no, you tell me, you're going to send this patient home, somebody's going to self-isolate, and he's got congestive heart failure. Okay, fine. Because guess what? If he dies, who's going to get the lawyer? I'm going to help him get one. Okay, so you have to look at this as a human situation. And it's divided into threes. Number one, social, cost, insurance, all that other kind of nonsense. That's what's so nice about Obamacare. If you don't have insurance, they give it to you. Number two, what are your genetic and physical properties? What are you predisposed with? If I have diabetes, I have hypertension, I have obesity, I have these things that low-grade inflammation. Now I get COVID, I'm going to go over the top. And then the third thing is, what am I doing? Am I wearing my mask? Am I washing my hands? Am I self-isolating? Or am I going around people and coughing all on them and letting them cough on me?
Wait a minute. You just said that I might be part of the problem? Never. You just told me I have to be responsible for. No, I know you just didn't tell me.
Let me tell you, my patients know I'm hard on them because I don't want to hear it. See, I don't want to hear it. I want your blood pressure log. I want your glucose log. And when you come in my office, the first sign you see is no salt means no salt. It doesn't mean seasoned salt. It doesn't mean, you know what I'm talking about, garlic salt. It doesn't mean obey. It means no salt means no salt. And that in itself brings your blood pressure down.
Okay, so actually, Brooklyn, I think so. So what Brooklyn says, what does treat, oops, wait a minute. Because I think I understand it, but sometimes things get lost in translation. So Dr. Hankins, she said, what does treat white people like humans mean? Why not treat everyone, blacks, whites, everyone like humans? Please explain. I think that's what you said in the end, but if you can explain that a little bit further.
The reason I say that is because I want people to think.
Mm-hmm.
See, I want you to think. I want you to think about the racial disparity as to how blacks are treated. You know, we have our own set of laboratory values, which is insane. So how I do it, and I'm not only America's top doctor, but I'm leading physician of the world. And I got that honor because we reverse kidney disease in my office. Okay. And you know how we do that? We don't follow black kidney values. We follow white kidney values. So if you follow white kidney values, you get the same results as white people. You don't.
And what do you mean when you say the values? Because again, remember, and I do this a lot of times, I think I'm talking to other lawyers. So when you say you follow white kidney values, what are you talking about?
Ask your doctor what your white kidney value is. You're going to find there's a white kidney value and an African American kidney value. If you follow the African American kidney value, you're going to have two bad kidney disease by the time it's treated. So follow the white value. But I was responding to her question. Okay. And in terms of whites as human beings, what we do in our healthcare system in this country is we treat people in terms of profit. So white or black patient, but specifically when a white person comes in, they look at them and say, is this cost effective? They do it for all people, but we already established there's a disparity with blacks. But is this cost effective? So if Medicare says I need to see this person 3 times a year, if you do it more than that, I'm not going to pay you. This is what the insurances do. They say, I'm not going to pay you. If you see a patient too much, if you see them too long, if you talk to them too much, we're not going to pay you because you're not cost effective. That is true whether you're white or black or brown or yellow. So what I'm saying with that is I want you to think. Let's treat black people like white people. Let's treat white people like human beings. So essentially in basic algebra, let's treat people like human beings. But if I said that, that wouldn't have the impact of black treat like white, white like human, because each one is a component. There is no reason that someone should get paid if they withhold care. Look at that. I get a bonus if I withhold care.
Yep.
I make a profit. Listen, I make a profit if I get you out the hospital. It's not a matter if you're ready to get out or not. But the hospitals are paid per diagnosis. So if I have a diagnosis of shoulder pain, not you're going to be in the hospital with shoulder pain anyway. They say shoulder pain and they pay the hospital $500. If you're in with shoulder pain and something happens, they still getting that $500. So if I'm a business person, if I want to stay in business, if I want to be a hospital, I want to get you out before that 500 post. That is the problem when I say human beings. When that person walks in your life, whether it's a medical practice or a store or whatever you do for a living, I think what the first thing you should say is from the Rubaiyat or Omar Khayyam, I am human. Nothing humane is alien to me. That should be first. That is a human being. And by definition, you should do your best. I happen to be Christian, but that doesn't mean a darn thing to a lot of people, okay? But it means a lot to me. My father was Muslim, my mother was Christian. They married and died within months of each other. And they said, you serve God by what you do. Martin Luther King said it even differently. You should judge a person by the content of their character. What is your character? What are you treating people like humans? When somebody gets on the internet and says, I want you fools that's following me, y'all keep playing basketball, y'all keep coughing on each other, because guess what? It's a conspiracy. And if I'm wrong and you die, guess what? It's your fault you followed me. Now, how is that human?
Let's talk about those conspiracies, because Ish is going to just die if he don't get to know something about 5G radiation and how that's the reason that we all had COVID-19. So Ish says is that all he knows is that last year the U.S. and China were at war because of 5G, and that he heard that wait a minute, he heard or he read or something. Where'd it go? According to physics, radiation waves can produce flu-like symptoms that are harmful to the respiratory system. I heard that 5G towers have high amounts of radiation waves.
I can't speak to that. One thing I do is stay in my lane. I know what I know very well. I know nothing about 5G waves.
Mm-hmm.
So I can't speak to that. I can speak to the virons and all of that because that's what I know.
Mm-hmm.
I'm not opposed to that because it seems to me with all of us got these cell phones upside our head. I mean, it's got to be doing something. But I don't think that there's enough empiric evidence by people that I trust that do things based on heart. See, the people I deal with, they deal with love. They may not be doctors, they may not be lawyers, but they're lovers of humanity. And they know that's my number one goal is to serve humanity, serve God, and try to make this world a better place. When you come from that perspective, you do the best you can, but I'm going to be in my lane. I can't speak to 5G. I'm not saying you're right or wrong. I haven't done any research on it.
Okay. Have you ever actually treated a patient with radiation poisoning?
No.
Oh, okay. Yeah, I didn't know that. That was the reason I asked the
No,
question.
I would suspect I never would. Because if someone has radiation poisoning, they got it from somewhere. And I'm not going to be around anybody that's exposing me to overt radiation. I'm not that kind of fool. Okay.
So if somebody had radiation poisoning, they would be actually exposing you to that radiation poisoning as well.
Well, like I said, that's not, I have no reference. That's like asking me, do they serve coffee on Mars? I have no reference.
Okay. Now, Bilal also said that we're supposed to have herd immunity. I don't know what that's in reference to.
Okay, herd immunity is that, like when you give your kids shots for measles, some of the kids don't get the measles shots, but because they are around other children that are immune to measles, they pick up the immunity. That's called herd immunity. The problem with that is the fact that we have not been exposed with the coronavirus before, so we don't have herd immunity. And by the time we develop herd immunity, 4% are going to die, and of that 4%, 50 to 70% are going to be a minority. So what we're trying to do is to not wait for the development of herd immunity to stop the exposure by having the distancing, which has worked fantastically. You know, I think it's one of the few times in America where people just come back and say, wouldn't it be nice if we can do that with climate change? You know, just boom, everybody not drive on Sunday. Let's have some clean air. Everybody not throw plastic in the water. Okay.
Well,
and think about this.
COVID-19 gave us that opportunity, didn't it? So what happened? You know, pollution for the first time you can see over London. So
Yeah,
that's always
but guess what Trump did? Trump released the EPA standards. He released environmental controls. So in Louisiana, where they have one of the highest COPD rates, the one of the companies is giving out all sorts of chemicals in the air. So we're not even getting that benefit. You know, they said in India they can see the Himalayas now because there's no smoke. So my point is that the blessing that can come out of this is that we see the human impact on pollution and therefore diseases. We see what happens when we work together and respect everybody. And what I'm hoping is we start really looking into this healthcare disparity divided into those three components and attack each component separately. The social aspect, the physical aspect, and the psychological aspect. That we come together and attack all three of those things and have a panacea of good health. This is what I hope. I hope out of this death and destruction and murder, that we get good health.
So Bilal says that herd immunity is letting over 50% get it, and once you have it, you immune, and you can't spread it if everyone got or had it. So
that's not true. That's not true. And one of the reasons it's not true is because the immunity has to be a certain level. And we don't know yet because this virus is too new. Okay, you might get an antibody response because you've been exposed to it, but we don't know yet. And unfortunately, we don't have enough testing. we don't know what the antibody level is to protect you from the disease. This is why when you get a measles vaccine, you have to get more than one, because one shot won't give you that immunity. You have to have several. Okay, so you don't want to be exposed to COVID on a recurrent time since it's got such a high mortality rate. A better solution for that is to, in fact, decrease the exposure by the distancing and then taking the antibody levels and then seeing for the people that are immune what level we have to get at. So when they're doing the vaccine, that's one of the things they're going to look at. Do we have to do one COVID vaccine, or do we have to do two or three like we do diphtheria or tetanus? Do we have to do 3 or 4 and have a booster in 10 years? This is what takes so long to do the vaccines. But no, herd immunity is not going to work because we got 4% death, and then of that 4% death, 50 to 70% is minority. So as a minority physician, as a physician, as leading physician in the world, as a woman, as a Christian, I don't want to lose a person. And
well, so now we got a little war going on in the comments, and I'm trying to keep up so that we can follow them. Okay, so there's 2 different conversations going on, and hopefully you can address them both. So first, apparently, I didn't know anything about this. So what about the mandatory COVID vaccine? Let me see. There was a let me see. I'm sorry, because I mean, they going fast over here. So
I don't know what they're talking about.
Yeah, I don't either. So
yeah, they're just making stuff up.
Here you go. Here is. Did they, Joshua, did they talk about us receiving the mandatory vaccines? I just need to know what mandatory vaccines you're talking about.
Yeah, plus there are no vaccines.
Yeah, not for not for COVID-19.
Right.
So, and is there a flu vaccine?
Yes.
Okay, so now because that's the rest of it.
And an anti-pneumonia, which I say everybody should get a pneumovax. This one shot protects against 85% of all pneumonias for 5 years. I mean, if I could give you a diabetes shot, a hypertensive shot, a lupus shot, a cancer shot, an AIDS shot, I would give it to you. But we can't give you a pneumovax. So please take it. Have your doctor to you.
So okay, so Joshua, she said you got to know it's on the news. It's on CNN. So just so I understand, are you talking about this alleged vaccine
There's
that
no vaccine yet.
Is promoting that, are you talking about that vaccine? Is that what you're talking about? Because okay, now this is the one, because I can actually talk a little bit about this only because of the work that I've done. So in order for a drug to make its way to market, this is like everybody's like, oh, it's going to happen. There would have to be a team of teratologists to get involved, a team of epidemiologists. There's an entire process. We'd have to process through rats and monkeys and mice to see what, how it actually impacts the human body. This is not something that literally the COVID-19, let's say it's been around a year. It hasn't been around long enough for this process to have been that there's a vaccine. Now, they may be testing for things. That's like example, they actually said that, they're going to be able to make an artificial kidney. They've been working on this artificial kidney now for 12 years. This stuff doesn't happen overnight. It doesn't matter what they kind of talk about on CNN. It doesn't happen tomorrow, which is why Dr. Fauci and, Governor Cuomo tells you that a vaccine is 18 to 24 months out, because that's how long it would actually take it to make it through the process.
Now, they can't expedite it. FDA can't expedite, and they do have it on fast track. And I think that Johnson & Johnson is working real hard. So they might be able to cut that 18 to 12. But right now, there is no vaccine.
And then Brooklyn wants to know about, and I know with this one, hydrochloroquine. Well, chloroquine, I can't never say that word.
Hydrochloroquine.
There you go. Tell us about your opinion on this drug that Trump is.
I can't speak to it. I can't speak to it.
Okay. At this point, what I can tell you is it's an off-label prescription. That's what I can tell you. That's not.
And because it's off-label doesn't mean that it doesn't work. Doesn't mean that it does work. But I can't speak to it because of stuff that I'm personally involved with.
Oh, okay.
And that becomes personal, and this is a professional conversation. So I can't.
No, I understand that. So, and I thank you. I thank the good doctor for even being here because, even as an attorney, I know there are some issues that I'm aware of. And so as a result, can't speak to them. We're just a little bit, Doris, you ain't know, they know everything. They know everything. They do everything. Just the mysterious they. So, it's kind of like when Trump talks, it's always he's been hearing and some of them said, but he never identifies who they are. That's who they is. So don't worry about that.
I don't understand the question. I'm sorry.
She's saying, question, who is they? Because she's reading the comments, and there's a whole bunch of they said. What about they said? So
But the thing is, I'm answering the questions. I think using the industry standard. But
no, not you. She wasn't talking about you. She's talking about in the comments that are going on there.
But what I'm saying to them is, look at the source. Look at the Russian trolls. Look at the Ku Klux Klan that puts these things out. Look at if you're wrong. See, the problem I have with this is if you're wrong and you're leading people to get sick, 4% are going to die. And of that 4%, at least 50 is going to be minority. So why not lead people to health? That's my point. Because what we asking for COVID is not bad hygiene. It's not really difficult. We're saying if we want to survive as minority people, if we want to survive as humans, number one, be humane.
So, and kind of like to your statement is that Brooklyn says, I do see some of us still not following the social distancing directions. What's up with that? Black people know the risk, but some still ignore the stay at home guidelines. That's irresponsible. Brooklyn, I'm going to tell you what I see, not as a medical professional, is that unfortunately, this is the show me state. And until it happens to us, it is not real. Until it happens to our grandma, it's not real. How many times have I seen on social media, the YouTube videos, on Instagram? It is so many people don't believe it. Somebody actually said to me, well, do you personally know anybody that died? And then you say yes, and then they think you're lying. Well, Dr. Hankins, have you actually treated anybody who actually died from this disease?
I wouldn't speak to that.
Okay. Oh, I'm sorry. That's sorry, confidentiality. Sorry about that. Doctor patient confidentiality.
Respectful.
Mm-hmm.
See, I have a problem. And my problem is I respect human life.
Mm-hmm.
So for someone to sit up here and say someone's got to die in order for me to respect my life and the people I come to, I can't speak to that. I can't speak to any person that I've lost. I can't speak to any person that I might lose. What I'm trying to speak to are the ones that are alive now and say, why not this? Why not be healthy? Why not care? Why do you want to wait until somebody dies before you go towards health? This is my problem. I am not a Dracula. I don't suck blood. What we do is give life. So how about that? How about you tweet that? How about you tweet love? How about you treat health? How about you treat caring? Instead of worrying about if somebody died. So the whole implication of that question is, if you don't know somebody personally who died, you don't know what you're talking about. And my point, each patient I have ever lost, they stay with me. And that's why I'm fighting so hard to keep you alive.
I love the passion and the commitment, doctor. I really do. And I appreciate you being here today. It's definitely eye-opening when we start talking about what's really going on in our community and how it's actually directly impacting us and how we can all get together and do something together to limit this, our impact. I've said from day one life lost is too many. So I don't, one life lost is just too many.
Exactly. And the idea that you don't matter unless you're dead, it's just so morbid to me. I'm not the one, okay? And like I said, we're not the two. Anybody that's thinking like that?
Yes, well, hey, there's, people do all kinds of things. All we can seek to do, doctor, is try to educate, be, have information, and be the change that we want to see.
Well, I
Hold
want
on.
to
I
give my
think I
little
see another
segment
one.
with this, because I got to go.
Oh,
And
yeah, I was gonna say, I told you half an hour, and we're at actually half an hour.
okay, I just
Doctor.
want to end with this. Love
Mhm.
is an action verb. If people don't know you love them, you don't. Your love should be visible by all five senses. And this, what we're talking about with COVID, is a love story. I don't want to lose a person in Target or somebody that's playing crap or a granny that's in a nursing home that nobody cares about.
Yeah,
We
we
need
didn't
to
even
love
get
each other
about
to
the
help.
hospitals and the nursing homes right now, unfortunately.
But I'm just saying you have to stay with tabs of them. See, love is an action verb. Be active. Think about love and not death. That's my philosophy. See, that's why we practice medical and community care. And that's why I have one of the lowest mortalities of any doctor, because we push life. And every time a person dies on my watch, it's sad to me. That's how I was trained in medical school. And the good thing about that training is that when that person comes, whether they're alcoholic or live on the street with pus sores, or a prostitute this dying because her daddy keeps putting her back on the street, or a rich person whose family's trying to kill them so they can get her money, it doesn't matter, because that human being is under your care and you want to do what you can for them. And that's, if anybody takes anything away from this and all the cynicism, is that what does it hurt you to be kind?
And Dr. Hankins, thank you so much. Again, if you are looking for an internist, you can always reach out to Dr. Hankins medical practice at 215-842-1075. She's at 5811 Germantown Avenue. That'll be in the comments. And you can see her at Hankins and Associates Medical and Community Care LLC. Is that right?
All right, thank you.
Thank you so much. As always, I am Danyl Patterson, candidate for state rep over here in West Philly, trying to help you to have information that's accurate, up to date, and of the minute. We like to bring the experts to you to dispel the myths, give us some facts, sometimes cause a great debate. But regardless, what happens is that together we do better. Thank you.